If you have lymphedema in your arm and you're struggling with fibrosis, firmness, and discomfort from that lymphedema, keep watching. In this video, I'm going to show you different tools that can be added to your lymphatic massage routine to help reduce that stubborn fibrosis and soften those tissues. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and certified lymphedema therapist. Make sure you subscribe to my channel for more videos on how to manage your lymphedema. Fibrosis is a thickening, hardening, or scarring of the tissues. Lymphedema can lead to fibrosis because of an inflammatory process from the protein-rich lymphatic fluid and fat cells that are starting to pool in that area. Over time, the tissues become more gel-like and then can progress to a more solid, dense consistency. Fibrosis can make lymphedema swelling more severe, so it's important to address the lymphedema fibrosis as early on as possible and as soon as it's identified. Traditionally, lymphedema therapists address the fibrosis directly with their hands, doing specialized hands-on techniques to soften that fibrosis. But different tools can be used if deemed appropriate by the lymphedema therapist. Because working with our hands can be a little intensive, these tools can help reduce the amount of work we do with our hands and fingers, but they can also be effective tools to incorporate into your program. The tools I'm going to show you in this video should be part of a comprehensive program and not used alone. That means using these tools with manual lymphatic drainage or lymphatic massage, as well as compression, exercises, and skincare. Keep watching until the end of this video and check the links in the description for more videos on how to build your own comprehensive program. I do want to say that there's really not a lot of research on which tools or programs are the best to really reduce lymphedema fibrosis, but the tools I'm talking about in this video and showing you are based on the foundational knowledge that we have that fibrosis can be softened with deeper pressures, and this can also help with reducing fluid from that lymphedema. Some things to keep in mind as we go through these different tools are to first always check with your own certified lymphedema therapist or healthcare provider before using any of these tools. These tools are not for everybody, so it's best to work with your lymphedema therapist to determine what's appropriate for your particular case. Next up, only use these tools over intact skin, meaning you don't have any open areas, wounds, cuts, or scrapes. You also should not use these tools if you have an unhealed fracture, thrombophlebitis, osteomyelitis, uncontrolled high blood pressure or hypertension, or over areas of bruising. These should be used with caution if you have active cancer, you're on blood thinners or have blood conditions, you have active infection like cellulitis, you have varicose veins, or you have altered sensation in your skin and tissues, meaning if you have too much sensitivity or if you don't have a lot of sensation. Make sure that you clean the tools before and after you use them on your skin. You always want to have them clean. You should not have any pain when these tools are used, and you do not want to use these over bony areas like at your wrist bone. Additionally, you should perform some warm-up exercises prior to using these tools, and specifically remedial exercises, which are exercises designed to help stimulate that lymphatic system. I do have links for videos of those in the description below. These tools, when you use them, should always be followed by manual lymphatic drainage and compression to help move out that swelling and fibrosis and any inflammation that you have in that affected area from working pretty deep in those tissues. Again, these tools should only be used by your lymphedema therapist first before you try using these at home, and they should train you on how to use them. The first tool is pretty simple. It's a plastic dryer ball. So I like these to help with fibrosis because they're pretty inexpensive and they're easy to hold and move around. You want to start with a more gentle pressure, and then you can gradually provide more pressure as you roll through that fibrotic area. If the spiky ends are a little too sensitive on your skin, you can place your arm in a pillowcase or a towel on top of the skin, and then you can roll the dryer ball on top of that material to help make it be a little bit less sensitive. Another technique is using instrument-assisted soft tissue mobilization, or IASTM for short. These tools can be made of different types of materials, but the most common ones are made of stainless steel, and you can even get these types of tools online. Your lymphedema therapist may also be certified to use specific brands and treatment approaches. These metal tools for IASTM have beveled edges that are used in the direction that you're working, and you want to start with very gentle sweeps upward. I generally do about 1 to 2 minutes per area. These tools can cause a local acute microinflammatory response, and when used with fibrosis, can help with softening it. Redness is expected in the area and some bruising can occur, but we're not going for bruising with using these tools for fibrosis. We are using them a little bit more gentle at first and then progressively working into deeper pressure. There are a lot of different shapes and sizes that you can find online, including on Amazon, but you want to get one that you can easily hold and for a size and shape that's appropriate for the area that you're working. All right, next up is cupping. So cupping uses negative pressure to lift and mobilize the tissues. These can be a little challenging to control how much suction you're using, and you need to be very careful when you're doing this over areas of lymphedema and fibrosis. When used for fibrosis, a little suction goes a long way. Your therapist will use a little oil or cream on the skin, and then you can use them a couple different ways. You can do little circles in the areas of the fibrosis, and that's going to just lift up those tissues a little bit to help soften. Or you can get some suction and then move them up and down through that area of the fibrosis. Just like with IASTM, you can expect some redness with cupping and maybe a little bit of bruising, but again, we are not trying to get bruising with this method. It should be a little bit lighter. And again, do not use these on your own without proper training from your lymphedema therapist, as this is not appropriate for everybody. If you found this video, please like it and give it a share to anybody who would benefit from learning about these different tools to help reduce the fibrosis from their lymphedema. Thanks for watching. Make sure you subscribe to my channel for more videos on how to manage your lymphedema.